The August 30th, 2022 morning work session of the Portland City Council. Today's discussion is Portland Fire and Rescue. I'll turn it over to Commissioner Hardesty. Good morning.
Good morning, Mayor. Good morning, colleagues. It is a privilege for me today to do a brief intro to the Citygate report actually commissioned by Portland Fire and Rescue. Let me say that over the last few years, 2.5+ years, Portland Fire and Rescue has showed up at every single crisis that we have experienced in this region. They have not just shown up, but they have worked hard. They have been committed to making sure that people's health and safety were primary priorities that were addressed. I will say that this is the most challenging time since I've been commissioner in charge of Portland Fire and Rescue, due to the fact that we're at the beginning of fire season and we have firefighters that are absolutely exhausted. We have been internally speaking about whether or not there are incentive opportunities that we can give to our first responders who, again, have showed up at every single crisis we've had over the last 2 years. And I will say, just for the record here, that we've been discussing whether or not we should do a temporary double pay for mandatory overtime for firefighters who, again, have actually been at every step of the process responsive to the needs of the community that we serve. As an elected leader and a fiscally responsible public official, it gives me nightmares thinking about paying people double time for doing their job. But I want to say on this record today that if anybody has a plan in the city about how we do double time with a very limited amount of time, and with a very strategic plan of how we bring staffing up to the levels we need, it has been Portland Fire and Rescue who's been working on that for the last 3 to 4 months. So I just wanted to start with that. I want to appreciate the extraordinary leadership team that we have in Portland Fire and Rescue. And again, their absolute commitment to showing up over and over and over again, no matter how exhausted they are from all the other responses that they've had to respond to. And so without further ado, I will turn it over to Chief Sarah Boone to introduce her team and to introduce the Citygate report. Thank you.
Thank you, Commissioner Hardesty. Good morning, Mayor Wheeler and City Commissioners. My name is Sarah Boone, Fire Chief for the City of Portland. Today, Citygate and Associates will be making a presentation to Council on PF&R's Portland Fire and Rescue's current service delivery and staffing study. Also present this morning for today's work session, representing Portland Fire and Rescue Executive Leadership Team, Fire Marshal Carrie Schimmel, Division Chief Emergency Operations Ryan Gillespie, Division Chief Community Health Division Tim Matthews, Division Chief of Training and Emergency Medical Services Anjanette Jackson, and Executive Business Manager Kezia Warner. In 2020, Citygate and Associates were awarded through a competitive RFP process the contract to conduct an in-depth independent analysis of our deployment model, our organization, and our staffing levels. The last full comprehensive assessment was conducted in 2006 with a modified assessment done in 2011 for the rapid response vehicle deployment to assist with the rise in medical calls and improve response reliability for overall coverage. Today, you will be presented with the most comprehensive study to date of our resources, coverage, staffing, and organizational structure, and how effectively and efficiently we are meeting the community's service level demands and best practice performance measures. Okay, well, okay. Well, this was directed to Mayor Wheeler. There were two questions that were given to Portland Fire.
He's hustling.
Okay. All right. Okay. Right. Okay, in 2021, Mayor Wheeler, there were two questions he directly asked us regarding our deployment model. One was at the Community Safety Work Session, which was February 2nd of 2021, and then the Budget Development Work Session, March 18th, 2021. Yes. So the two questions that were directed during the Community Safety Work Session, as well as the budget, have the systems put in place adapted in a way that serves the needs of the communities today? And then the second question posed, is there any consideration of looking at alternative delivery models, given that the service mix is changing? It is our hope today that the information and data presented will help answer those two questions and provide council with the evidence-based data needed to make informed decisions about the level of service, alternative services, and staffing to ensure we have an effective, efficient, and adaptive fire rescue and emergency response organization. Thank you. I will turn it over to Stuart Gary and Citygate and Associates.
Good morning, Mayor and Commissioners. Can you hear me okay?
Loud and clear.
Thank you very much. Appreciate the time this is going to take this morning and your attention on this issue. Before I start the PowerPoint, I think you're certainly need to know who the talking heads are and briefly what is a Citygate and Associates. My name is Stuart Gary. I'm the Public Safety Principal of Citygate Associates. With me is Samuel Mazza. We are both longtime retired fire department, fire chiefs of department. Myself, this is my 52nd year in the fire service. I did not stutter. I started as a volunteer in high school. I have a bachelor's and master's in public administration. And as Sam retired as a chief of department, we've been consulting now for some time in our secondary careers. I've also been an elected official, a city council member in a suburban community here in the East San Francisco Bay Area, and was a school board president during the Great Recession during a great layoff of teachers. I appreciate the fiscal and neighborhood responsiveness issues that council commissioners have to respond to. And with that said, I'll start the PowerPoint. And the PowerPoint should be up full screen.
Yes.
Was that a yes?
Yes.
Oh, thank you. So Citygate's a 30-year-old firm of experienced public agency executives still committed to serving the public interest. We do not work for the private sector. Personally, the fire practice and I and Sam, we performed in the last decade and a half over 400 fire service studies. On the West Coast alone, we've served over 20 million residents. Our scope was a service delivery and deployment study to evaluate every aspect of your fire department's deployment, efficiency, effectiveness, and the adequacy of the headquarters program. In terms of metro scale, by the way, my current large metro clients are yourselves, the city of Fort Worth that we just completed last week, and the city of Los Angeles, which we're in the writing up phase. And we've served down to some of the smallest 1-2 station fire departments in the Midwest and everything in between. So we certainly understand the scale of scope of Portland's needs. How the study was conducted, we received over 1 gigabyte of electronic and documentation data from the agency, conducted deep internal and external stakeholder interviews. We've completed a comprehensive community risk assessment, and more on what that is and why we use it in a moment. A deep incident statistical dive, a service demand response analysis, and low acuity EMS calls, and where on the geography some of your newer response challenges and systems need to be. We conducted a broad geographic mapping analysis to include 24 citywide maps and 39 detailed east-west maps. So your fire department and city hall planning team can really focus in on the neighborhood level as necessary. We also looked at support and headquarters staffing, conducted multiple progress briefings with your team, and before you today, you've got a 167 plus page report summarizing all this information. Outcome goals in the fire service. As we talk with our elected official clients, we want to start with this basic restatement of what you already know, the public listening at home may not. That fire service deployment delivers desired outcomes. Councils and fire chiefs don't say, I want a response time of X minutes. We talk about what do we want to deliver for customer service. And in urban communities, that's typically for emergency medical, to prevent further permanent impairment for medical emergencies where possible, and to confine building fires to the room or near the compartment of origin. Nowadays in wildland fires, given the climate challenges, an outcome statement would be keep a wildland fire to 5 acres or less, prevent it from going to catastrophic proportions, for example. However, delivering those outcomes depends on adequate staffing, apparatus types, and response times to different emergency types over topography and a road network, which we've modeled. In terms of policy choices, we also remind our clients and newer elected officials sometimes across all level of government, always recall this. There are no federal or state laws or regulations in the United States mandating fire service staffing levels, response performance, or outcomes. This is a local choice issue in the United States. However, if fire services are provided at all, state and federal safety regulations apply to protect the firefighters themselves and the public they're serving. And those safety regulations have gotten increasingly onerous and expensive in the last 20 to 25 years. Thus, the level of fire service provided is a local policy decision. Communities have the level of service they can afford and they choose to fund. That may not always be the desired level of service, both during the Great Recession and certainly over the economic challenges of the last 2.5 years of the pandemic. Most of our clients always struggle to match desired service levels and outcomes to ability to fund. The department positives about Portland. Very diverse programs for a diverse growing city. Caring, committed staff. They're really focused on providing the best possible care to anyone, anytime, in any predicament. I can't stress this enough. This is not a traditional fire department only engaged in firefighting. They really care about healthcare, fire prevention, public education, and as we discussed this morning, they've got several very innovative, evolving programs. It takes a positive can-do culture to deliver on those changing programs. The new Community Health Division and its partners, Portland Street Response, Community Connect, which is being restructured, Community Health Assess and Treatment, which is new. You're partnering with Care Oregon for funding, coordination, and evaluation in a pilot project is frankly extraordinary. And while many of our Metro clients have your challenges and are pilot testing different things, you're one of the first healthcare partnerships at this level that we've seen. You're also not afraid to employ non-traditional employees.
Excuse me, you're starting to have some sound issues. I don't know if that's us or you, but the echo is pretty intense.
I got it also.
Okay, hang on for a sec. We got our tax folks looking at it.
I think that was CA Council when they unmuted, but they muted themselves, and it seems like it sorted itself out.
Excellent. Okay, we're moving on then. Thank you.
Thank you. To continue on the positives, innovative recruiting and hiring programs exist, significant use of federal and state grants to fund services outside of the general fund. And as we're going to talk about some of the headquarters staffing gaps in the normal budget process, the chief and department have already started to improve some of those programs and employee assistance, for example, professional standards oversight, and in a wildland fire programs coordinator position. So while the study's been done and due to delays due to COVID is just now getting before you all, I want you to know the department's not been standing still and has been working issues in parallel. So fire service deployment strategies. As we talk about response times and geography now for a few slides, just remember two things this morning. The speed of response matters and the weight of response matters. And the speed of response is that single neighborhood-based first responder to do just about anything in a call for help requires. And most of the time, they mitigate the emergency by themselves. Single unit, crew staffing, tools and equipment takes care of a small to modest problem. The weight of attack refers to multiple unit response, what the public calls the first alarm, when we need multiple crews in a fairly confined time frame to keep a small fire from becoming catastrophic, or a multi-patient EMS incident, or a technical rescue, or a water rescue on the river. Multiple crews are needed for the more complex events. And then you also need to staff specialty units in lieu of the traditional engines and ladder trucks, such as hazardous materials and technical rescue units. You have those. Three challenges the study's going to refer back to, and as I briefed the executive summary this morning. High volume EMS incident demands, and that's normal across America in the last 10 years. The ever-growing volume of EMS has become all-consuming to the fire and EMS services, as healthcare in the United States has left more and more under or uninsured, and EMS has become the healthcare, sometimes a first, last, and only resort. More on that in a few minutes. Challenge number two, insufficient overhead and administrative staffing for the program managements, both today and upcoming. And in some areas of the city, insufficient fire station coverage. We'll talk about that. Risk assessment. We talked about outcomes and determining an outcome. Keep a fire to the room or area of origin. Help those with medical emerging crisis problems when 911 is called. So our risk assessment methodology says to best practices nationally, what's being protected? What values are at risk in the city of Portland? And we use planning subzones, fire station districts. We look at the values to be protected, what the hazards are, the probability based on historic incident demand of a hazard occurrence, and then what's the consequence severity. Single patient EMS is of great consequence to the family, the loved ones, not necessarily of great consequence to the city at large. And we look at the impact severity of the hazard occurrence and multiply them and generate risk scores by types of emergency citywide. That's all in the study. Just understand that we're basing our response strategies on the risks and outcomes. Your values at risk, resident population, as you know, is well over 600,000 today. Your daytime population grows even higher. Using your city demography and planning group numbers, you're projected to grow by 40% by 2035. Even if only half that growth is realized on the dirt, it will change and challenge some of the department's existing response systems. You've got over 300,000 residential housing units, another 38,000 plus or minus commercial buildings. Of that 38,000, 1,500 are critical facilities under federal designation. Those are the buildings and institutions critical to the fabric of modern society functioning in a healthy, safe way. Power, water, sewer, healthcare, telecommunication nodes. And another 1,800 maximum high-risk occupancies that, due to the types of business conducted in the building, from healthcare to hazardous materials manufacturing and everything in between. We take note of those. We evaluated the hazards in 6 broad categories: the typical building fire, vegetation, medical emergency. Also in a metropolitan city, hazardous materials, use, release, and spill potential, technical rescue. In your case, it's not just off-road in the hiking open space areas, but it's also marine and water rescue risks. Let's talk about service demand over time. So when we commissioned to do the study and pulled 5 years of data, it was 16 through 20. Yes, 20 had unusual statistics due to COVID. All of our clients experienced different demand changes during early COVID. Some lost call volume, some gained call volume. Some clients actually increased simultaneous calls while the overall volume was lower. We're just telling all of our clients, don't trend assuming COVID was the new normal. COVID was the aberrant year, and as you hit 21, 22, and 23 data, look back over the longer haul not just the COVID year or year and a half. But the blue bars are EMS. EMS in most agencies today is anywhere from 55 to 75% of total call volume. The red bars are fires of all type, not just building fires. Fire in America has largely been lowered due to the success of fire prevention and modern building codes, but the risk is still there.
Stuart,
And then the gold
Stuart.
bars are everything else. Yes,
Stuart, sorry to interrupt. Commissioner Maps had a question.
sure.
I have a question about what the other bar consists of, but I suspect you're going to get there.
Yeah, I just was trying about, thank you. Sorry, I didn't see the hand raised earlier. The other bar is anything not in the federal incident report system categorized as fire or EMS. So it's hazmat, tech rescue, citizen assist. It's auto accidents that don't result in EMS. It's literally dozens and dozens of events that don't get pigeonholed into the fire and EMS bucket. It's not cats in a tree. It's not helping Mr. Smith necessarily back in bed. And it's a good question now to ask when I show you response times in a few minutes. We calculate response times only on the blue and the red, EMS and fire. We do not look at response times to other, because most of the other responses are not a red light and siren emergent response. If you look at service demand by month over the years, fairly constant service demand, a little bit of a ripple seasonally, but this means you need a 12-month baseline of customer service. Yes, we've got some recreational area, smaller clients who see a big swing in summer or winter, perhaps. Most urban areas are fairly constant for demand across 12 months, meaning you need fire services at about the same level 12 months a year. If we look at it by hour of the day, midnight's on the left and then midnight's again on the right, you'll see a year in and year out, even at 3 and 4 a.m., you have a demand for customer service that rises to in the morning rush hour, reaches what we call the shoulder of the day, in your case, fairly early, about 9 a.m. And then you can see from 9 a.m. through about 8 p.m. in the evening, you're above that threshold of 4,000 calls annually, year over year. And that daylight pattern, especially for EMS events, is predictable because most EMS events, of course, are driven by humans. And when humans are awake and doing our thing, we generate more calls for service than we do at 3 a.m. Very typical curve, typical of everybody, all of our clients, especially in the Western U.S. Now let's look at the utilization and the busiest fire station areas. These are fire station areas. This is the percent in a year of each hour that there are open incident running. So we can measure in dispatch how many minutes per hour there are active incidents in a defined area. And the percent of the hour committed to one or more open incidents is in this table. The darker reds higher than the lower colors, and this is just the top 10. Otherwise, the table wouldn't fit in PowerPoint. As you can see, station area 7, which when I show you the map in a minute as a reminder, is not in the downtown core, is the busiest station area that starts to get busy at about 8 a.m. and stays busy clear through and almost past the 10 to 11 p.m. hour. So you say, well, Stu, why show us the table? What do the numbers mean? What we look for in demand pattern analysis, when we see 30% hour after hour after hour, so long runs, 4, 5, 8, 9 hours of 30% or higher utilization, the district and or the individual crew unit is getting too busy and they're not going to be able to clean up, rest, relief, eat, and do the other fire service duties they have to during a core 8, 10, 12-hour workday. So there is an upper limit to crew and area saturation, and it's 30% hour over hour. You're not there yet, but you've got some units and some station areas knocking on the door in the mid-20th percentile. And as we talk about alternative EMS response and low acuity EMS, this is going to come back to be very important. If you intervene and control the low acuity non-emergency EMS, and transfer it off the fire crews, these numbers will stabilize. If you do nothing
Excuse me,
about the low
Stu?
acuity,
Stu?
yes.
Could I interrupt? I just have a quick question. Why was 2020 used as the year, which is, as we all know, an anomaly year to collect data from? Is it just because of the timing of when you were contracted?
Yes, it was the most recent data year of the 5 years we pulled, and yes, if anything, it's a little low. And the department needs to update post-study for 21 and 22 and see what the trends are as I won't say we're returning to normal, but we're past the bulk of COVID.
Thank you. You can go on.
So now let's talk about simultaneous incidents, affectionately called lightning strikes in non-professional terms. And where do multiple calls for service occur in a small geographic area? And in this case, in a large metro department, you'd have 2 incidents open 75% of the time. If there's 1 call for service running in dispatch, there's 2 calls for service running. Well, eventually you get down to 3 or more simultaneous incidents, which would be actually 4 incidents. 39% of the time, you have 4 incidents open if 1 is open. Well, Stu, why does that matter? Because at peak hours of the day, 4 to 5 units running at once is the equivalent of an entire first alarm worth of crews committed to individual incidents, typically EMS. If those simultaneous requests occur in too small of an area, I don't have a firefighting and tech rescue force left, and I'm drawing outlying units into that area to handle the additional calls or the major call. And sure enough, in Portland, the simultaneous incident rate is far more predictable in battalions 3 and 4, which is downtown and out east around Station 7. It just is what it is, where your population densities are the highest, especially during waking hours. That's where the simultaneous events occur, and that puts a strain on the deployment system. And our role as analysts and advisors to you is to help the department understand that it needs a baseline standby capacity for when something serious breaks. And you hope not to fight fire every day, every week, or even every month. But at the end of the day, you need some amount of fire insurance, which is standby force, ready to go to the really serious things. And if you consume them all with single response EMS events, you may not always have the firefighting or tech rescue force the moment you really need it. And I'm not saying you don't send fire to EMS. You're talking to somebody who went to paramedic school in the 70s. I firmly believe in first responder emergency medical care, but there's a balancing effect here in terms of deployment strategy. So let's look at response time performance. Well, let's frame now risks to be protected by what is our time goal. On the left, 2 tables, sorry they don't fit beautifully in PowerPoint, but they're both complementary. On the left is survival to brain death when there's not enough oxygen reaching the brain. Time 0 is on the left, and by about minute 8, if the heart is stopped or beating so irregularly as to not perfuse oxygen to the brain, brain death is starting at minute 5, 6 to 8, and largely becoming irreparable, irreversible from 8 to 10 minutes. So if you're trying to intervene in a life-threatening medical emergency, be it bleed out from trauma or not oxygenating the brain, you've got about 8 minutes from 911 saying, hello, what is the problem, to get there. Time matters. Coincidentally, on the right-hand side is the home fire timeline. And at moment 0 on the left is when free burning, open flame starts in a compartment, not smoldering in the couch pillow, but open flame. And when open flame starts, fire doubles in size every minute. It doubles in size every minute. So with open flame, by about the same 8-minute to 10-minute point tops, sometimes 4 to 5 minutes, everything in the room of origin has become heated to its ignition temperature, and the entire room is now exploded in fire. And once that entire room is burning, it's going to start to chew its way to the walls, the attic, down the hallway, and into the rest of the structure. So we calibrate for positive outcomes the first responder to be there in less than, well under, hopefully, 10 minutes from time of 911 saying, hello, what is the problem? So let's look at how Portland Fire did over the 5 years of the study. This is a busy table. We'll walk through it here. The first row is call processing and dispatch. And if you look at the second from the right column there in white labeled best practice, call processing from hello, what is the problem, to being able to electronically alert the crew should take no more than 90 seconds. 90% of the time to fire and EMS incidents, not the others. So in Portland, across all years, it took longer than 2 minutes. And in 2020, more due to COVID protocol, it crept up to 2:41. If we look at crew turnout time across the years, Citygate, not best practices, we've always recommended 90% 2 minutes. The department's hovering right around 2 minutes historically, was a little longer in 2020 due to COVID protocol and putting on the right protective equipment before responding. Getting 18 seconds, getting that back down under 2 minutes, 24 hours a day is eminently achievable. And in fact, the daylight turnout times are more like 90 to 100 seconds.
Stuart, can I ask you a question on this? And
Of course.
thank you for the data, and this really underscores that seconds count. How much of I assume at some point you're going to wrap this all up and tell us what the bottom line is and what your recommendations are. But one thing that has definitely increased since 2016 is traffic. And some of these items that you've listed here could be traffic impacted. And I'm just curious to know how that's worked into your thinking.
We've modeled it and have exquisite measurements that are about 3 slides away. So thank you very much
Thanks.
for the insightful question. Because now I'm going to hit it for the first 3 times. First unit travel. So row 3, just driving time for fire units to an emergency, not AMR ambulances. This is your fire units. Driving time is consistently north of 6 minutes and actually increased a bit during 2020 when in theory there was less traffic congestion, right, due to shelter in place. Best practice nationally is 4 minutes, 90% citywide travel. So you're over 2 minutes longer than 4 minutes. Well, let's wrap this into what counts. I showed you the time, temperature, and brain death curve. Your call to arrival has historically run 90% past 9 minutes. Longer in 2020, but a best practice of 7:30 if you're really trying to get there in under 10 minutes. Now, 8:30 is okay, but remember, wheel stop first unit doesn't mean you're at the patient's side. If it's a garden apartment complex, a high-rise building, or you're a boat in a marina, wheel stop just means I parked at the address. Now I have to access the patient or the fire and begin intervention.
Stu,
So
Commissioner Mapps has a question.
Go ahead.
Thanks. Stu, before we leave the slide, or maybe as part of your explanation of the slide, can you dive in a little bit more and tell me about dispatch? I'm the commissioner in charge of 911. And one of the things I'm curious about is when you start counting.
Yep.
And I'll let you tell your story, and then if I have any thoughts, I'll jump back in.
Thank you. Well, and I really appreciate the learned inquisitiveness because the bullet below the table answers this question. So let me just finish the last row on the slide is multi-unit travels. Remember I talked about first alarm and weight of attack? Best practices for good outcomes would say the last arriving unit. So if I send 4 engines, a ladder truck, and a chief to a working house fire, I want the last unit to get there in 8 travel minutes. And in Portland, it's taking on average about 10 minutes or a little more than 2 minutes past 8. Having said that, given your station spacing, which is too wide in the non-downtown core areas, getting everybody there by minute 10, I have some Metro clients who would love to have that measure alone. So hold the thought that your weight of attack is not too far off, but your single unit speed of attack is under stress. Now let's talk about dispatch. In the data years we pulled, and we had to forensically go back to the Communications Bureau several times, we now have alignment that the numbers we're reporting are correct to 90% of the fire and EMS events from hello to crew notify. But historically, the Bureau has not used best practices in reporting. They were only reporting averages, not 90 percentile, and they were only reporting from hello to queued. And queued is when the call taking dispatcher gives it to the dispatch console to alert the crew. So they weren't measuring the whole time slice. And this is not unusual in the United States, by the way. I'm not picking on Portland. Just institutions grow up and somebody says this is the way we report response time, and it continues, right, for 3 generations of executive leadership. They were only measuring average, which is the middle of the data set, not how far past average everything is. And they weren't reporting from hello to fire crew tone-out. So we've recommended, and they understand, they're going to change the reporting practices to be more consistent with best practices in fire in EMS.
Stu, can I jump back in here?
Yes.
So I think I'm tracking, but I'm not sure, and I want to. As the commissioner in charge of BOIC, the buck stops with me here on this one. I also hope that you and my colleagues recognize that there's both the time. When do you start counting? Is it when the dispatcher or the call taker picks up the phone, or when you dial? And I want my colleagues to know that as of yesterday, I think right now it takes us about, on average, 87 seconds to pick up the phone. I think one of the messages from the past a couple of slides is that first 10 minutes is incredibly important. You know, we need to get fire or an ambulance there within 10 minutes to kind of hold things down. We basically lose a minute and a half on hold right now. It's an urgent problem we need to do something about.
Thank you, Commissioner. And I'm aware of the media coverage, and what you just described is what's called the electronic ring time, right? I finished dialing the third digit, the 1, ring, 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 ring. So best practice is to pick up, to say hello, 15, 20 seconds. And staffing and total call volume, high tide times of the day, affect the time to hello. The numbers on this slide are after hello. So these numbers don't even include whatever you think your existing lag to pickup is. And most computer systems, by the way, and they differ by city, most dispatch computers weren't wired to track hello off hook. They're wired from first keystroke. So I'm Dispatcher Smith. Hello, what's your problem? I'm typing into a screen. There's no timestamp yet until I hit enter the first time. Oh, I've got an active incident, not a wrong number. So in other systems, the 911 telco system will tell you, they know electronically when you go off. So as you refine your data metrics, you can refine the ringing on hold time, and then you can refine when the human dispatcher said, hello, what's the problem?
Great.
So we now trust from hello to crew notify 90%. These are really good numbers, and it took a lot of effort to get acceptance and verification that these were the right numbers. And we worked with your leadership in communications.
Great, but it would also be the case that because there is the wait time, you probably for this, you should, if our wait time is now 87 seconds, that's our typical call hold time, we should probably add another 87 seconds to this data in terms of what's actually happening in the real world.
If you added, yes, to the 90 percentile point, now you've got some happening faster than that. But if your 90th percentile is 80-some seconds, yes, there's room for improvement.
Great.
And as we talk on the last bullet, this is really one of the most important discussions to have today. Time matters. And there's 3 managers of time, and one of the management techniques is tough. Manager number 1 is what happens in 911. It's a manageable electronic human staffing set of issues to manage. Manager number 2 is the fire chief. And the fire chief manages turnout time, readiness. Manager number 3 is travel time. Well, that's the whole community. You've built a community over 50 years. You've got grid downtown, right angle streets. You've got curvilinear, low density subdivisions. You've got hills. You've got artificial barriers, rivers, bodies of water, freeway interchanges. I would be Pollyanna to say traffic engineering should design a fast response time travel network, and the reality is you can't. And that's before the injection of traffic calming, walkable, livable streets, infill live work units, and everything that society should be doing. And the more you congest the road network, you're going to slow travel time. And at some point, you're going to want to put fire stations closer together because the travel time is too long. And that's why, for example, if you went to downtown Manhattan and Chicago, in some of those downtown areas, you can almost see fire station to fire station. Why? Traffic congestion and vertical population density. To get to the patient in time, they can't drive as far because they're starting to factor in, well, I got to take an elevator 30 floors to get to somebody. So time matters. However, without what you just mentioned about ringing time, if dispatch and turnout times in this data array saved, rounded off, 1:30, your current fire station system to urgent emergencies is getting there in 8:21. You're in the zone of reasonableness, even though I'm going to show you your station spacing is a little thin in spots. So this is not an unattainable goal. If you focus down on dispatch and crew turnout, you make some slight adjustments to response strategies, you're going to deliver less than 10-minute customer service to 90% of the emergencies. The other thing before I leave dispatch for all the commissioners to understand is certainly for EMS, there is a need to do call prioritization, which is asking several clinical differential questions. You have an accredited center. They're trained how to do this, however, the more the clinical sorting questions that are asked delays getting the dispatch made. So some of this 2 minutes from hello to crew notify is asking all the questions to the EMS events. And you're newer to accreditation and sorting in dispatch, and it takes time and quality assurance to train the dispatcher. If you hear these 3 or 4 things, this needs to be an immediate dispatch. It's a life-threatening call. Don't proceed through the algorithm further. You got to get the troops moving. You can finish asking all the questions. You can always de-escalate the crew, right? Hey, stop, don't go, red lights, or don't go at all. We're going to send the street team. Hey, that's fabulous. But if you hear some early clues, this could be a really serious emergency. You have to have a short circuit step called rapid dispatching to get that 90-second dispatch to the small count of calls that are life-threatening. Okay, moving on. Why average versus fractal? So average is the middle of a data set. And if this bar graph of travel time was a perfect bell-shaped curve, the taller bar would be the center. But in fact, 4 minutes, you've started to hit many of the calls in 4 minutes. And in 5 minutes, you're into the 75th percentile. But it really takes, in your case, 6 minutes before you've hit 90% of the incidents. So this is what we call a right shifted graph. You've got some calls downtown that are getting 90-second travel times. That's great. You've got some calls in the suburbs taking 6-7 minutes to get there. And that's why average doesn't tell you how many calls are past the center. In your case, you have quite a few calls past the center that the planning has to take into account. Let's look at geographic mapping coverage. This is a fairly accurate geographic computer model that is travel time over your street network the way fire trucks really travel. So this is not somebody in a sports car running a rally race. And the dark color is the traffic congestion loss. The underlying green color is 4 minutes without traffic. So we can get really, really good traffic congestion data, not social media catch can, but other data sources nowadays. And in this case, the green hardly touches each other for 4-minute coverage, except in the downtown core and a little bit down there in the southwest corner. And then the brown is the constricted due to traffic. And if you just look at the map, you can see some neighborhoods not touched at all, congested or uncongested in 4 minutes. Now, 4 minutes, remember travel time is that middle between the bookends of hello to I'd like to get there by about minute 8.5. If we go to 5-minute travel, many of those gaps close in the next 60 seconds. So let's go back to dispatch and turnout time. If I planned my physical fire station spacing to be no more than 5 minutes apart and control dispatch and turnout to 3 minutes, 5 + 3 is 8. I'm still in the target zone.
Stu,
So
what's going on in the areas with no color at all? What does that mean? How should I interpret that?
You're beyond the reach, in this case, of 5 minutes from a crew in a fire station.
Got it. Thank you. And what's purple then?
So purple is the 5th minute. Green is 4 minutes.
Okay.
Purple's the next 60 seconds.
Okay, great. Thank you.
And that's assuming they're in quarters, right? Available to respond, not clearing another call half a district away. So we have to do something to geographically space your resources out. And this is a planning estimate tool. And we're saying if you adopt new customer service, revised customer service goals, you could do station spacing up to 5 minutes, not 4 minutes, because some of these gaps, there's not enough undercovered road miles to economically or call volume necessitate a whole nother station. So the headache is when you have these small pockets and seams, what to do with them. This is the multi-unit response force. This is driving time again, but it's 8 minutes. But now the computer says, show me every 100 block that gets 4 engines, a ladder truck, and a chief within 8 minutes driving time. And as you can see, the green is where that occurs uncongested, but during traffic congestion hours, it collapses to the center, right? The edge units come into the center. I can get 6 units and a chief there in 8 minutes, but the rest of the time, I can do much better than that.
Stu, how much of this is, because you threw in and a chief, is how much of this is as a result of that individual, and can that authority be delegated?
The authority can be temporarily delegated. Yes, some of this is a result of both the chief and the engine being the last due unit. So here's the engine only coverage. So here's with truck and chief, the coverage is a little more expansive at rush hour with just 4 engines.
Okay, but it's not making a huge difference. It doesn't look.
It makes a difference when you look at the risks and population densities. I would be more strident with other recommendations, and I'm not in your case, because the population densities and the serious fire rates are smaller outside of those areas.
But the chief does not travel with the rig. Is that correct or incorrect?
That's correct. The chief and the ladder truck are single units.
But they're not just going to sit there and wait for the chief. I mean, these guys know what to do. If they arrive on scene and there's a fire and the chief isn't there, they'll go ahead and start the response, right? I mean, so I don't understand why the chief matters in this example.
Because eventually you're taking the first or second due fire captain company officer to be the temporary incident commander who has responsibilities under the law for safety and controlling the incident. and ensuring no harm to the firefighters or the public. And taking that crew leader off the crew now cuts the crew by one. It's a crew
I
of
see.
3,
Okay.
not 4.
Okay.
And that line fire captain has been trained to be a really good fire captain, but may not yet have had the training credentials to be on a promotional list and be a permanent chief officer. So eventually, in 8 to 10 minutes, we want a chief officer to show up in severe fires, 2 chief officers now into the safety standards, one to be the commander and one to be the separate safety officer to manage the overall incident. So they're not inside or near the burning building. They're in the street in a command post sense, talking to dispatch, partners in law enforcement, partners in EMS. You've got to have an orchestra leader. And the orchestra leader's got to stand back and have situational awareness and be aware of safety and everything going on, and let the crew unit leaders do the tactical work inside the building under his or her direction.
Got
So
it.
yes, it evolves, and it evolves very organically. They're highly trained and they know how to roll that out. But eventually, we want to say, do you have enough chiefs citywide to get a battalion chief to the serious events, not just from a single headquarters building?
Got it. Thank you.
So we also then extensively in the study today, this is just a taste of what's in the full mapping study. Here is the density of where you tend to have more than not EMS rescue events over this is 4 years of data. And you can see your demand for EMS and rescue tends to be in the more populated downtown core. No surprise there. In other cases, it follows certain roadway and types of commercial public open space usages. And then out in District 7 in the eastern city, there's again enough population density and socioeconomics demands for EMS. If we look at the building fire structure density, much more in the older downtown core, but also fairly uniformly to a lighter extent throughout all the neighborhoods. So said this way, every fire station area experiences structure fires in an annual to 4-year basis, just not as heavy
Excuse
as
me,
in the urban
Stu.
core.
Could I interrupt for
Yes.
just a sec? I just want to know how many more slides you have, because I think us being engaged in a conversation about what's being recommended, I want to make sure we have enough time for that conversation. How many more slides do you have? I know how much you love
Off the-
fire service and talking about it, but
Off the top of my head, about 10 more, and I'll slide through them.
okay, yeah, if we could
So,
speed it up.
So you asked, you asked the road mile question. In the study, here's the percent of road miles covered in the minutes by congested, non-congested. And you're losing, you're losing about 16% of your reach due to congestion. So the data is in the table to answer that question. Now, low acuity EMS. This is the second most important thing. We worked with your medical director and the clinical patient transport records to say, where is it more likely than not we're going to patients who do not need a ride to the hospital in an ambulance? And this is by census tract, and it's concentrated in the downtown core and out in Fire District 7 in the east. Very predictable, high density locations. We then counted those census tracts and bracketed them into a few high acuity patients. So remember, you can still have a heart attack patient hiding in a zone of low acuity patients. You got to go to the heart attack patient. And we looked at the count, we ranked them by station area. But here's the bottom line. In 10 census tracts, were 47% of all your EMS incidents in 5 years. 47% of all EMS was in 10 census tracts. That's averaging 25,000 incidents a year or 67 a day. Focusing your emerging different response systems on these 10 census tracts is job number 2 after focusing on the time clock. So your low acuity different response strategies are your community health division. It's stood up. It's going to take a year to 2 to fully staff to the vision. Fire will need to continue their high acuity response model program in addition to low acuity. Fire cannot spare responders to support community health delivery. That's going to be a different layer of personnel, hopefully less expensive than firefighters, but it's got to be different. You don't have a firefighting force left if you were to fully transfer firefighters to community health responses. And they wouldn't do mental health, et cetera, anyways. They're not credentialed for that. Now, we talked about the low acuity areas. Here are your high call volume fire crews and station areas, and they're in two clusters, out east and in the downtown core. Why does that matter? Well, yes, we know they're busy. They're going to get busier. Now let's look at your growth areas. We worked with city planning, and we said where in the remaining general plan and what the applicants are telling planning, where is the greatest amount of density of new growth going to occur? And it's right on top and in the already busiest areas. You're going to do more infill development where the system's already under workload strain. And I'm not saying that's bad. You just have to plan for it and see it coming. So 3 issues, geography and road network, can't do much about. High volume EMS demand, you can respond to differently with non-fire crews. Insufficient fire station coverage, especially out east where the city annexed fire districts in historically and just never built more infill fire stations. Population growth is going to occur in your high demand areas. We've talked about improving dispatch time. We feel at least one additional station out in Station 7's area is necessary. Engine 23 south of downtown is currently a squad. It should be restored to a full fire engine crew. And you're going to have to long-term obtain permanent funding for the new low acuity response program. If that funding is not obtained, this is what your future would look like without that innovative program. Probably 8 low acuity 2-person fire squads, another 3 peak activity fire trucks, full fire truck crews, but only working daylight hours to manage the simultaneous call for service impacts. And we really are stressing focus on tier 1, the low acuity alternative response, not adding more squads and fire engines. And if you do neither, longer response times are going to increasingly have a disparate impact on neighborhoods that are further away from existing fire stations. Headquarters assessment. All of the business units are moderately to severely understaffed because of years and years of budget restrictions. Not this administration. It's not the last 2 administrations. And most of our clients, it dates to the Great Recession when people preserved fire station staffing over headquarters logistics, training, and quality oversight. But your failure of care and those risks are increased if you don't have the equipment, training, and quality oversight on your medical personnel. We also felt the department had outgrown its prior organizational structure. More on that in a second. Your EMS community health teams will need training, supervision, quality of care. We feel headquarters in a master plan sense over 3 levels of priority could ultimately need 35 more positions. But in phase 1, especially as you roll out the healthcare program, 16 positions are needed. We've itemized those in the report, and I'd like the commissioners to understand these are not all senior executives. These are workers doing wildland compliance, communications, infotech, budget, policy, planning, logistics, and more for EMS training, and quality oversight. And we recommend the department split itself into a 2-branch operation where there's 2 major branches, management services and operations, reporting to the office of chief to free up some of the chief's time from the day-to-day decision-making and impacts to be more strategic and community focused, especially with regards to community health partnerships. So a slight realignment of the org chart there. Next steps, adopt updated response time goals to drive your investments in fire services, obtain permanent funding for the new health programs beyond the initial Oregon Cares partnership. As needed, measure those impacts on community low acuity responses, and then do the fire crew enhancements as we recommended, and begin to fund a multiple year capital improvement plan for at least 1 more fire station out east, starting near Station 7. And I'm done. Thank you for your attention.
Thank you, thank you, thank you. I know that there was a lot of information to digest. I'm very grateful that I had the opportunity to have a detailed briefing on this study and this report. And I am very interested in what my colleagues have to say or the questions that they have around the information you found. For me, I think the big takeaways are over the years, we have taken resources away from the administrative structure that allows fire to actually have the infrastructure necessary to do the great work that they continue to do. I think that that has shown that we've done that over and over again. When I first got here in 2010, in 2019, it was 2010 when the world changed as we all knew it. In 2010, as all bureaus were asked to take those kind of significant cuts over the first 2 years of COVID, fire also did that. But fire started at a real disadvantage and not having that a deep enough infrastructure in place as well. Clearly, when I first saw this data and these numbers, they are mind-boggling, and it is like overwhelming to think that the amount of staffing necessary to have the world-class fire and rescue system that we want means that there's a lot of investments that have to be made. But what I know is that as we think about building a community safety system, the city has moved away from really thinking that one bureau can be all things to all people and really thinking about how the system itself, our community safety system, actually supports the safety of the community. And the two programs that you highlighted, Portland Street Response and a community health assessment team, are two models of really thinking outside the box. And I want to compliment the chief and her team for not coming to the general fund looking for money to do a study, but in fact going out, raising the money, getting grants, and actually hiring professionals to bring this data back to us. It's clear we're not making any decisions today, but I hope my colleagues will ask really hard questions and give us an opportunity to go back and do additional research or find the answers for you as we start preparing for the next budget cycle, as we continue to build a community safety system for the city of Portland. We cannot forget the vital role that Portland Fire and Rescue plays in ensuring that the community is safe and the community needs are met based on where the community is, not based on what the community can do for fire and rescue. So I will stop talking here and open it up to my colleagues for questions. I see Commissioner Rubio has something.
First, I just want to say, Stu, thank you for that really impactful presentation. It was very, as my colleague said, and I'm sure my other colleagues agree, very eye-opening and really drives home the sense of urgency and where our work is cut out as a city. And I know that our fire department has been working really hard and overtime and are very stretched. So I have a couple questions. First, in terms of the changing climate, how much has climate factored into our new reality and the landscape in terms of the kinds of calls we're getting? And then the second one is there were a lot of things that we need to do on that list to become where at the responsive agency we want to be, that's supported and well equipped and well staffed. What is the sequencing in terms of where do investments go first that you would recommend to us?
We've given you a bit more, this is also our work backwards. We've given you in the full report a bit more specificity on sequencing and timing, but I would have you think in these two broad strategies. Time matters, and there are some time issues you can work on without hiring more people. Well, Bureau of Communications aside, they've got other issues, and I, again, wear the press. So I don't want to be over simplistic there. There is a staffing issue likely there. But issue number two is to continue to stand up the community health programs. and find long-term funding partners, right? The pilot project's going to prove successful. There's no way it can't, other than to say, we're keeping patients out of emergency rooms, but to work with CARES Oregon and federal, Medicare partners, the world of ambulance payment has to be shifted politically to pay for non-emergency room destination assistance. And that's happening too slowly across the United States.
Stu, I can
Back
tell
to
you.
that.
Stu, excuse me for interrupting, but let me just interrupt by saying that our congressional delegation has been working with us for the last 2.5 years, really trying to shift that conversation at the federal level. And I really think that because of the pilot project, we will have a lot more political clout to try to move that conversation at the federal level. You're right. We have to change the funding streams about how those dollars come in, who has access to them. We're working on that. So I appreciate the advocacy, but that's on our list.
Fabulous. I appreciate that. And well, I won't offer an opinion as to the speed of change at the level of Medicare, but it's finally at least starting to become conscious to the issue. Last question was climate change. You don't have enough time to listen to what this 50-year fire service veteran knows to be true. I don't care if it's permanent. I don't care the long term. Here and now, we're in a different climate cycle. And for the balance of our careers, if not our time on this planet, the climate changes really matters. And the wildland fires, both grassland and timber, the heat emergencies during triple heat days, especially in communities not prepared for the heat, the drought. Remember, I've got Midwest clients, Texas clients. I'm just not coastal California based. These challenges are going to strain society at peak periods, right? Very cold, very hot, wildfire driven, whatever. And your emergency services are going to have the strength of training and the resiliency of deployment levels to meet those community crisis days.
I have a couple of questions. First of all, your overlay of areas where the Fire Bureau has already reached capacity being overlaid with projected areas of growth, I found that very interesting, and I appreciated that as just one metric that you were looking at. I want to start with a general question. You mentioned at the very beginning of the presentation that there was stress to first responders nationally. And I want to be clear, it's not just the Fire Bureau, it's our emergency management system, our 911 call center, our police bureau. We're seeing stress across the board. And your data cuts off in 2020. My suspicion is 2021 was even worse. And when you collect the data for 2022, I expect to see that trend continue and possibly accelerate. What's going on nationally, in your opinion, as a professional who served for many years and looked at different systems across the country? Why is there an increased reliance on first responders? What's leading to that? Stuart, you're muted. We have to say that once per meeting, or it's not an official meeting.
Yeah, you're right. And you'd think I'd know by now, but I admit I was just distracted. My infamous orange tabby cats found the open window in my office, and I'm trying to not on camera get the cat out of you. Anyways, so I muted myself while I manhandled Mr. Cat. The short answer is, as response systems became more capable, and as healthcare access and health education, preventative healthcare decayed, our population just got in the habit of, if I need anything, help is but a 911 call away. And all of our public safety institutions have kept saying yes in the short term, right? I'm going back 30, 40 years now. And we kept saying, aye, aye, we can do that. Oh, we can hazmat, we can do that. Tech rescue, we can do that. Marine firefighting on the river, you bet. High volume EMS, well, what's high volume EMS? So we go to 5 more ambulance calls a day. No big deal. You spin forward 30 years and you say, oh my gosh, how do we handle this tsunami of workload? We do police studies too. And I've got a whole nother police team. Same issue on their side. You know, the amount of really, really acute time sensitive calls in policing is small. But the import of those other calls to society in managing human crisis issues is still important. There is no easy answer. It's all the above. It's all of us as a society saying, how can we take care of some of these issues without calling for a big red toolbox with a light and a siren?
All right, and I appreciate that, and I don't think anybody has a monopoly on the truth, but I wanted to get your perspective as a professional. You mentioned the number of structure fires. I have heard anecdotally that our fire bureau is responding to quite a large number of structural fires in homeless camps. First of all, Chief, can you tell me how many on average you are responding to? And then Stuart, can you tell me, is that worked into your data as part of structural fires when you talk about the increase?
Which chief?
The big chief,
big
Chief
chief.
Boone, Chief Sarah Boone.
No, I'll be very clear. There's only one chief on this call, and it's your fire chief. I'm the consultant.
Mayor, we can get you that data as far as the average. I just don't want to put something out there.
I've heard it's as many as 7 per day. Does that sound right?
That does not sound.
No? Okay,
Let's just say
if
the
I
fire
could-
numbers have gone up.
Okay, I'd love to get that data. And when you're talking about structural fires, how are you, Stuart, back to you, different chief, I suppose. How are you defining structural fire?
So they're defined in the National Fire Incident Reporting System, and they have to be a building or an outbuilding. So but the red bars I showed you were all fire types, and we track auto, vegetation, homeless, houseless, fires. I will tell you across the client base and anecdotally where I live, 30 minutes east of Oakland, serious, devastating, if not deadly, houseless encampment fires, and even tragically already one tiny home fire of Oakland has occurred when the occupant left daylight hours, did something that started the tiny home on fire. Those are increasing and are frustrating all of my clients because accessing them safely
That's a good
is
point.
increasingly
In
a
the back.
concern to the firefighters. And I'm talking even, I've seen photographs of small communities built under overpasses with wood frame buildings and structures. So it's an issue, and they're doing the best they can.
Thanks, Stu. And that's a great point. That's something that we as a council should take into account as we're thinking about our land use planning. Another.
The fire marshal can answer that question as well.
Great.
I didn't. Excuse me, Madam Fire Marshal. I thought maybe you could answer this particular question because I know we've changed radically since we've actually reduced the use of fireworks and some other accelerants that make life difficult in hot weather. Would you like to respond to the mayor's question?
Sorry, I was looking up the first question about the houseless fires, so can you repeat that one again? I'm looking at our stats right now.
You go ahead.
So what was the question, Mayor?
So the question was around the definition of structure fire. Stuart then said that it, and Stuart, if I'm not repeating you correctly, please feel free to jump in and correct me. That sounds like physical structure fires, bricks and mortar type structures, as opposed to temporary or automobile or outbuildings or ancillary. And then he was mentioning that with the increase in the number of tiny homes and ADUs and the like, those structures, and I'm reading into what you said, Stu, tend to be not easily accessible. They tend to be in the backyard, down a narrow lane or whatever, and that's also becoming frustrating to first responders who need to respond to fires in those kinds of structures. Stuart, first of all, did I get that right, what you said? I don't want to misrepresent it.
90%.
And
So I would not append yet to that comment the increase in density in ADUs,
okay,
because most of that were the lots big enough in a residential area, a detached rear buildings pretty accessible by the average fire crew.
got it.
I was commenting under trees, makeshift camps, under freeway overpasses, between sets of railroad tracks that aren't easily accessible by the fire truck.
Okay,
It's in those hidden pockets that when they build shelters or park a motorhome, that becomes a problem.
thank you.
Yes. Yeah, I can say on the ADUs and the small structures, that goes through the same permitting process. So it is more difficult, but that is being reviewed for water supply and access issues. But for the houseless encampments, as we know, what we see is just a fraction of what's out there. And so they are embedded and it becomes very difficult. There's some spots that you can't count how many RVs and cars, and they're just pretty deep in the wooded areas. So that is a focus on, obviously, the wildland hazard areas and what we're seeing. And it's very difficult to get to.
Thank you.
Yeah.
I appreciate it.
And your name for the record, please?
What's that?
Your name for the record.
Oh, sorry. Carrie Schimmel, Fire Marshal.
Tough job, and we appreciate your service. And I've only just got one or two more. So part of our unique first response system is the relationship between the Fire Bureau and our ambulance service, which is contracted through county government. We don't contract for the ambulance service, but I understand there's some work rules that are perhaps unique in terms of who can actually do what. Like, I understand that transporting somebody to a hospital is the purview of AMR, for example. Did you look at that dynamic between our first responder operations and our response rate and some of the unique challenges around that dynamic between the city and the county and the AMR contract?
No, that was not part of our scope, nor were AMR's response times part of the scope. The only place where county EMS data and your commonly shared medical director helped was on identifying the types of low acuity patients and where they were in the geography. But to your other points, no, in your particular scope of work, we were not tasked to study those issues.
Thank you, Stuart. I appreciate your clarity on that. And then one final question, this is more of a general question. As you looked at the data and you saw the response rate, and you've identified some pinch points for us and some problem areas, is this unique to Portland? Or are you seeing this nationally? Tell me where we fit in just in terms of what you're seeing more generally.
You're fitting into the national pattern as one of several current and recent metros. It's a good typification. You're on the high side of average. You're not yet to a crisis point in deployment or back-to-back calls. You have time to catch it. You have time to build an adequate differential response system. In other communities, I've got clients that have squeezed 4 to 7 ambulances and fire trucks into a single station. They can all but walk from the station to the houseless camps. They have very much older building stock. They have a more severe structure fire rate. You do not have those challenges. You're a well-managed, beautiful urban area, and you've got the challenges of an urban community. And I would take this report in stride to say over several years, we have time to mitigate and manage so we don't end up so far behind that quality of life on the streets is suffering.
Thank you. Commissioner Mapps has his hand raised.
Thank you, Mr. Mayor. And I want to start out by thanking Commissioner Hardesty, Chief Boone, and Stuart for today's presentation. I think this is a very important conversation. And I will quickly circle back to the mayor's comments about AMR. I recognize that you folks didn't, AMR wasn't part of the scope of your study, but I do hope that the city at some point in the near future conducts a similar analysis about how AMR fits into our larger public safety system. I have lots of questions today. I'll ask a couple and then maybe take a break so other folks can get in. And my questions fall into a couple of different buckets. I want to start out with some data questions. First, going back to the very first question I asked today about the slide that showed service demand. Your presentation and your analysis today seems to focus in on fire and medical calls, but from what I remember of that slide, it seems like about 40% of fire calls were in that other category. And I'm curious about what's in that other category. Because that obviously is a huge part of fire's workload, and I don't even know what's inside that box.
So the short answer in terms of time is lots of things. But in the report, if you go to the type of incident demand tables, and then there is a second table by property classification. So we break it into a micro level of calls, and then what types of properties, 1 and 2 family, multifamily, restaurants, bars, they're all there. So the National Fire Incident Reporting System is very data rich, and most of that deep dive is in the public report that we've given you.
Great, I will dig in. It's a big, thick report, and I'm excited. I know there's a bunch of stuff I can learn from there. My next question might actually be for Chief Boone. Early on in this presentation, they talked about the outcomes that we're looking for here. In the fire space, there were kind of 2 outcomes that were talked about. One is making sure that people who are undergoing some sort of medical crisis don't suffer any permanent damage from that medical crisis. The other goal here was to make sure that we contain a fire to the space where it initially started. Chief, do we track outcomes? Do we track, like, if someone shows up for a heart attack, do we actually track how they did once we drop them off at the hospital, or do we assess how well we did in terms of actually containing a fire?
So we do have a metric when it comes to containing a fire to the room of origin. And then we also have a metric that we track when it comes to survivability rates for cardiac events. Beyond that extension, I think as well as STEMI stroke, but beyond that, we don't have the layers of data like the county, but we can always access that and get that.
Great. If I were interested in seeing those performance metrics, what document would I look in?
Well, if you want medical, we can reach out to the county, and then if you want the fire statistics, we could provide that for you.
Okay, probably maybe as we get further into planning processes, I probably would like to see that. Last data question goes back to Stuart. Stuart, do you have any, I heard a bunch of different numbers in terms of how quickly we want to get fire trucks or first responders on scene. I think 5 minutes, 8 minutes, 10 minutes. Do you have, and I recognize it's complex and subtle. Do you have a recommendation in terms of how quickly we should get first responders on the scene?
Yes, and in the report, we've given you specific outcome-driven policy, suggested policy goal adoption to include all the components of time. But in general, the takeaway today is 1 responder from hello to wheel stop in 7.5 to 8.5 minutes is the target zone. First responder, 7.5 to 8.5 minutes from hello, what is the problem? If it's serious. Now, if it's hello, my 5-year-old has stuck his arm through the fence and I can't get it out by myself. Important to mom, not a red light and siren call.
Great, that's very helpful. I'll probably return to that number in a minute. I have further questions, but I'll lower my hand now in case anyone in the room actually wants to ask questions.
Sure. Mayor, I'll go ahead and go. All right. Hi. First of all, I want to start off by saying thank you to you, Commissioner Hardesty, for organizing this. And Stuart, Gary, it's good to have you here. I noted your list of accomplishments. One of them included being the chair or president of a school board as one former school board chair to another. Thank you for your service. And it is the week that our kids in the Portland area are going back to school. So it's a great day to talk about safety. I also wanted to acknowledge the leadership team here, and it's good to see you all. I'll probably have a lot of my dialogue will hopefully be with you. No offense, Stuart, but these are the people that we're going to be working with on a daily basis, and also all of the women and men who serve our city throughout the city 24/7. And we saw great visuals that made that really clear. I appreciate the questions that were coming up, and Mayor, you chose a couple that I wanted to go a little bit deeper with, because I don't think we got to the heart of the matter on some of them. And so I just wanted to stay with the fact that we're dealing with a humanitarian crisis on our streets that's unparalleled. I mean, you go around the country and it's there, but Portland really does stick out. We have so many people on our streets suffering because they are using substances daily. Their mental health episodes daily. And we live in a state that offers the fewest amount of treatment centers for this high rate of incidents that's occurring on our street. I just know that the people that work in Portland Fire and Rescue are dealing with this daily. And back to the statement, we have the fewest amount of treatment centers. So then again, where do we take people when they're suffering and they're crying out for help, or a neighbor calls for you to come help them, because many times they don't have the faculty to go ahead and the agency to make that call. So I just want to get more onto that topic, because I think that truth is a very important thing to have in the public realm. And I realize that this is an issue that you're dealing with daily. And some of it is just, talk to me, how is this for morale for the people who serve our city at Portland Fire and Rescue? And what can we keep doing as commissioners to provide support as we collectively come together to deal with this humanitarian crisis? And I wanted to pause and have this dialogue with all of you, because in the work that I'm doing in this area, I don't often have a chance to be in front of all of you. And I realize you are the first responders many times to this issue. And I don't think it gets enough attention. So I kind of open the floor. I could start with you, Chief Boone.
Thank you, Commissioner Ryan. That's a very broad question. Our duty and our...
By design, because I think it's important that we have some real heart of the matter dialogue.
Yes. Our people that wear the uniform and step into this position, whether you're the fire chief or a firefighter or somebody on probation, you've raised your hand, sworn oath to serve others. You put community ahead of your own self-interest. You put the team ahead of your own self-interest, and you put the organization ahead of your own self-interest. It is always doing something more for others because the need is so desperate. What I have seen over the last few years is a tremendous effort, not only from this department, but everybody under the public safety umbrella, as well as within the city of Portland when it comes to government workers. We care deeply. We care about the community, and we care about the people working next to us. We are a department that sends people into harm's way. We have to be highly trained, technically proficient, and very competent in the decisions we make, because they do determine the outcomes of whether somebody lives or dies, or at least has hope. The greatest challenge we are seeing today is a workforce that is understaffed, limited capacity with an increased demand, and trying to manage trauma. Over 37% of people in the fire service experience PTSD, and we still come to work. We shove that deep down so we can be there for others. There are times that you measure between going to work or committing suicide. And somehow, because of the uniqueness of the organization of the profession, being a family, those bonds run deeper than just being a coworker. We lift each other up. We help our families, because we're all connected. It really is how you rise together through trauma. It is adapting as an organization and bringing people in from the community that have lived experiences that some of us have never experienced in order to expand our reach and compassion to communities that have been underserved before. So I will say, back to your question, I will say this department, Portland Fire and Rescue, it's about the people. And as much as we look at the community and we know that there's suffering, we know that there's livability issues, we know that there's substance use addiction, that's a reflection of our department. That's a reflection of us as well. And so I will just say the bond is not just with each other, it's with the community we serve. And we will rise together. Anybody else can answer too.
I would chime in real quickly. My name is AJ Jackson, and I'm the division chief over our Medical Services and Training Division. And just to follow up on Chief Boone's statements, because they're 100% accurate, but I think some of the struggle with the crews on the line is this constant demand in the metrics for how they measure how they're doing, their efficiency, how well the call goes is being challenged because it's the repeat. And we're very much a group of folks that like to show up on scene, have a positive impact, change an outcome. And I think it does take a toll because it's the repeat that I'm not making an impact, but I continue to go on these calls day after day, trying to find a way to alleviate this person's trauma, stress, whatever that moment is. And I think it starts to wear them down when they feel that the work product that they are responsible for is not having that positive outcome. I think another challenge from the training standpoint and what I oversee is how do we better prepare our firefighters for these new tasks or new tactics that have to be deployed to meet the community's needs? And how do we better respond? What training can we provide that historically have not been in our repertoire so that our firefighters have a better ability or a better chance, whether it's the services they provide or how they deal and process with that call after the fact? And I don't think we've been able to pivot as quickly, given the numerous challenges as we've had over the last couple years. How do we deliver that training? What does that training look like? Because it has to evolve to meet the needs of today. And I think a lot of our focus in the past have been about our tactical decisions, how we deploy the resources we have. But we're really being asked to have a different set of tools in our toolbox that we can reach to and execute just as we have for decades before when it's come to fire and emergency services and how we answer the calls to medical situations. So that was a little long-winded. I apologize. Thank you.
I created this, so that's fine that it was long-winded. I think it's important for the public to remember that we're dealing with an unprecedented number of overdoses on our streets. The new meth that's out there is no one knows what to do. And the withdrawal period is up to 10 times minimum of what it used to be with other hard drugs. And then the fentanyl is one reason we have the escalating overdoses on the street. I'm just in this moment so aware that you're the front lines for much of that work and it doesn't get lifted. So I wanted basically to just have this dialogue to say that we're aware of that and that you're dealing with some unprecedented incidents that, and I'll do fairness to it, that didn't come up when we were looking at some of the factors right now. And those are the big factors that I'm seeing out there today. And I know that, we all know that cities weren't built for people to camp in. They just don't have the infrastructure. I had a chance to get to know is it Sergeant? Wait, Fire Marshal Schimmel, because you represent the permitting side. And I become so aware of how important permitting is in the building of this city. And we look even in the little tiny homes for the villages, we've had to go through a permitting process. Clearly there's thousands of people living on our streets that there's no permitting process. And it's sad. And so they're out there in dangerous conditions. And then we're in the middle of one of our hopefully final heat waves at the end of the dry season. So you all know this is like a peak period between now and usually when the rains come in, hopefully October, right? And so just know that we're all holding you with all of those concerns. I did want to ask one data question, and I was troubled by, this is a nice pivot, so now pivot data. The other category, Stuart, was quite large, and I wasn't real satisfied with, well, first of all, I usually don't think federal compliance data is that great. It gives you a little bit of the scope, but if you really want to do continuous improvement, be innovative, you got to go deeper, and internally, you have to create your own data sets. So I want to ask, do we have any breakdowns of what that other is? Because it's such a vast category. Just curious.
Good morning. My name is Ryan Gillespie, Division Chief of Emergency Operations. So just quickly on that data set, the report does lay out what the other is. One piece of it that I don't think Stuart mentioned is, I'm going through a few microphones here, so, is dispatch, I'm wearing them out, dispatched and canceled en route. So that is when a fire crew is dispatched from BOEC on a call and then canceled on the way there. And that can happen for a number of reasons. It can either be additional information from dispatch. It can be a co-response with AMR where they arrive first and then they cancel us because it's a lower acuity call. That is a big chunk of that other data set that's in.
Commissioner.
It does speak to, oh my goodness.
That one's green.
Wow. Apparently I'm not supposed to say anything. So,
Microphone whisperer.
we'll try number 4 here. It does speak to improvements needed system-wide. So that is correct dispatching, correct response, and as the mayor alluded to, working with the county and AMR and the city and how that relationship works, who manages the ambulance service agreement, and how we respond with them. So there's definitely some work to be done there.
Okay.
But it's
and I'll look into the report deeply. I haven't seen it, so
yeah, and once
thanks for
you
that.
look at it, please reach
Yeah.
out and let us know. I'm happy to answer further questions.
I just
about
want to end with saying how helpful it was to talk about how all these issues connect. I work with Commissioner Rubio, we all do, when it comes to big planning issues. And we all want to see, as we move forward, more densely populated neighborhoods with access to transit. But I have never, this is my aha for the day, the overlay of the concerns or the capacity strains that it puts on fire. And I've never thought of that. I don't know if we've ever factored that in. At least I haven't seen it budgetary-wise when we're building our city forward. So it was really helpful to make that dot connection. Thanks.
Thanks, Commissioner Ryan. Commissioner Hardesty, then Commissioner Mapps, then Commissioner Rubio.
Thank you. I just wanted to step back for a moment and say I had the privilege of going to a Black Fire Chiefs convening in St. Louis a little while ago. And let me just say to my colleagues that looking at this leadership team that is sitting in front of you today is a very unique leadership team in the history of fire and rescue across the country. I was absolutely shocked to know how diverse we were and how we stood up next to many of the bigger, better funded fire bureaus across the country. So it took organizations like Care Oregon, which again, we didn't ask the general fund for a penny to start that pilot project, because what we know is that when people see fire and rescue staff coming, they know instinctively that help is on the way. We can't say that with all our first responders that show up, but there's never a question that fire and rescue will be there and will take care of whatever the most current need is in that moment. Having said that, fire and rescue is changing. It must change. It must adapt to the new reality of both workforce development as well as responding to community concerns and issues. And you will see some of that innovation starting to take place around who we are bringing in through Portland Street Response and how those folks get connected to Portland Fire and Rescue. You will see that as our first electric fire truck is actually presented later next month, I believe. Yes, heads going up and down. We are looking at building fire and rescue for the future and not for the historic nature of the way fire and rescue has operated in the past. But I do want my colleagues to know that we must invest in all of our community safety systems, because none of our community safety systems work if we don't make a serious investment in all of them. And so this is the very first opportunity that Portland Fire and Rescue has had to really talk about these staffing challenges that they've had for quite some time. And so, Chief Boone, I want to put you on the spot and talk about the lack of infrastructure that allows you to keep people certified, that allows us to continue to build what is necessary to make sure that we have a functioning fire and rescue system. Maybe one of your other chiefs, you want to take that question on, but I do know that having the right infrastructure in place, we've cut a lot of your infrastructure. So if you could just talk about whether that is analysts, whether that is the people that are doing your medical certification, because if our folks aren't certified, they can't work. Could you spend a little time talking about that? Because, my colleagues don't have the detailed knowledge. We've talked about this for years, but this is a great time to have that conversation.
Thank you, Commissioner. I just want to ground us back to also what our responsibility is as part of a system when it comes to the 911 system, which is emergency, rapid response, and intervention, and the things that we do hopefully change outcomes. And I just want to make sure, as we talk, we are just one part of that system. And so when we talk about from the call taker, the community member, where, and this is just the 911 system, the rapid emergency response. When somebody's in need, it doesn't matter where they live within the city, this is our responsibility, is they call 911. And what we know today is from the call taking to the to dispatch, to our responsibility, how quick we get on the appropriate rig for the right type of response. You look at the speed in which we, as well as if it's a larger incident that requires multiple units, that's the emergency response force. So the timeframes that we look at, 8 to 10 minutes, your survivability rate, keeping to a fire to the room of origin, or at least to the structure of origin, where we're not, where we're able, I guess, to have outcomes that are successful. Where we are falling short as a fire department is we haven't set a standard when it comes to the time frame. So we're using outdated 4-minute travel time, right? We know that our turnout time is a little bit higher than the 2 minutes when we look at national best practice. But at the same time, even in our data, fire is not incorporating the dispatch time. So what you guys have today is definitely a system that was built that is not meeting the community's standards, your standards in service delivery. And that's where we need to address that. That's just one part of the problem, right? So we have to at least be able to capture accurate data from the point of call taking to when the wheels stop and an intervention happens. The other thing is the risk. And Stu has not gone over that, but it's in the document. I think it's volume 2, the city's assets, what we protect, in addition to human lives. And these are lives that under acute circumstances, you only have minutes to live. But at the same time, we know that there is a huge humanitarian crisis. We know that they're in a public health emergency, community safety partners, being innovative in the programs, looking at Portland Street Response, community health assess and treat. Everybody's looking at that across the board. But I also want to remind people that those are things that we are partners in. The emergency response is what we're responsible for. Those are the station locations, the right amount of staffing, the critical assets that the city protects, and are we effective in our response? And so in order to get there, you look at the administrative and the organizational structure. And we are about 20 years behind. We have not adapted to the 21st century and the demands of an all hazards, fire, emergency medical services, and technical rescue agency, and also taking on additional programs, a new division when it comes to upstream strategies and programs. The 16 critical positions are what we need for span of control, for training, for oversight, management, equipment, accountability, and quality control, and data analytics. So we're kind of, I will just say in this moment, 16 critical positions, because as a fire agency for a major metropolitan city today, we are 20 years behind, and we can't meet demands structurally. When it comes to response and coverage, there are some recommendations. East County, talk about planning. That's where your density is going to be. You look at your infill, it's going to be vertical. We don't currently have this, and then the geographic area, East County, long response times because of the travel time. You are going to need to hire more if you want the same level of service.
So Chief, I'm going to stop you there because I know we're about to run out of time. And let me just say, it was absolutely what I was looking for in my response. And let me say, just like you, both of us have thought outside the box since we've been in these positions here. And we haven't actually assumed that we would reproduce what we've done for the 200 plus years of fire service in Oregon or around the country. What we're doing is building a fire team for the future. And we're building it understanding that there's climate change issues that fire is on the front line for today, like never before in the past. We know that we are also need to diversify and make sure that women and people of color are much more rapidly introduced into fire service. We also know that we don't always need a big truck to go on calls because it is a medical call versus a call that requires a ladder and, you know, a fully functional truck. And so I appreciate this study. Let me just say, I appreciate the real detailed information that we have because I suspect my colleagues and I will have more questions as we start preparing for next year's budget process. But what I will say is it is a mix of what we're building towards as we come out of this pandemic, as we become a city that all income levels can afford to live in again, because that's not the case today, as we start thinking about how do we create opportunities, economic and employment opportunities for people who are here today, not for those who will come tomorrow. All this is a part of that planning. And again, I just want to compliment the incredible work that's been done by Portland Fire and Rescue. And I know under very trying circumstances and in some really frustrating times. So I just want to say thank you, I appreciate that. And Mayor, I may have to leave a little early.
No problem. Thank you, Commissioner. Commissioner Mapps, then Commissioner Rubio, you get the last word.
Thank you, Mr. Mayor. I'd like to take a minute and build on a point raised by Chief Boone, and I also would like to share some observations with my colleagues. The point has to do with response times. Today, we've heard from Stuart that our goal should be to try to get first responders on the scene within 7.5 and 8.5 minutes. I'll also tell you that this past Saturday, the average wait times just to stay on hold at 911s for 2 minutes. My goal is to pick up those phone calls within 15 seconds. The reason why it's taking 2 minutes as opposed to 15 seconds has to do with staffing issues that we have. Now, if I can fix those staffing issues, I can give another minute and a half or so back to the Fire Bureau. And I think that's very important. I think there's some very, I think from Stuart and the good folks over at Citygate, I think there's some lessons that BOET can learn. If Stuart and Sam will have me, I'd like to meet with you in the very near future to unpack some of the best practices that BOET can embrace. I'd like to do that. And then I'd like to talk to my colleagues within the next 30 days to come up with a plan to see how we can speed up BOET so we can get those fire trucks out the door and on the scene within 8.5 minutes. Thank you.
I just have a quick question. And first, I just want to thank you all for being here. This is really, really informative for all of us. Very heartened also to hear Commissioner Mapps and his sense of urgency for getting those response call times down. It's very important, and so it's great to hear that we're having this conversation right now. I took a tour out at the Foster floodplain yesterday with BES staff and park staff, and they certainly heard from them about their concerns as well about the sensitive ecosystems out there and fires that have also happened out there. And so my question is about the map. You showed the map. You talked about the outer southeast Portland or outer southeast Portland and outer northeast not having the coverage it needs. Can you talk to me a little bit about how is the response going for those parts of town right now, and what is the gap, and is that part of the urgency too when we think about sequencing? I would just love to get a picture of that. From my own knowledge.
Yes, so to not overstate, can you hear me okay? Mm-hmm. Good, okay. To not overstate multiple competing issues, the response times in the East are strained, adequate in some locations, not so much in others. Simultaneous calls, low acuity call volume hurts out there. The fact that you can't, even if you had unlimited funds, just to site and build and construct one additional fire station is a 3 to 5 year proposition of local government, assuming you don't have the parcel today. Station 7 has 2 units, plus across that Tasman rig. It's very busy. And we have in the report and discussed with staff, as the new low acuity teams come on board, the way to stabilize response times in the East, short of a brick and mortar facility, is to locate some of the emerging low acuity teams out there to keep the heavier staff, rigs, and crews available for more serious calls. And I want to stress again, this leadership team inherited, and I've got the years in the report of the annexation in both East and West Portland, and you annexed in fire districts with sole or 2 fire stations, and they've stayed that way for decades. So as you intensified gradually populations out there, you've strained a historically thinly staffed fire station network that the city itself never really planned, they inherited.
Commissioner Ryan, then Commissioner Mapps, did you have something else?
I have a 1 minute, less than 1 minute off.
To go with your 1 minute now, and then we'll go to Commissioner. Are you done?
No, I just wanted to hear from.
Oh, I apologize. Sorry, Commissioner Rubio didn't get a response. I apologize.
Thanks, Commissioner. I think, Citygate and Associates basically gave us a plan and a phased-in approach over the years. But what's important is really addressing the low acuity calls, the mental and behavioral health crisis. That's what we're doing when it comes to on the city's investment for Portland Street response, as well as community health assessment tree. Those are the low acuity. That's when you look at all the medical calls, 48% don't need to be transported to the hospital. if we can find alternative ways to address the low acuity medical calls, it'll free up our fire crews to take the higher priority, whether it's vegetation fire, whether it's something a little bit more serious, and then it'll improve our response times. And so it really is it's looking at all the evidence and Director Myers and the Community Safety Division and looking at the types of calls and the most appropriate responder. And then really, what is fire's responsibility so we can have a well-rested, well-trained, and a speedy response that hits the time frame that you will be able to protect your forested areas, your natural vegetation, keeping a fire from spreading beyond the incipient stage. That's what at least the emergency ops for firefighters and the 4-person crews and the water and the fire management area, that if we're able to address a lot of things that are really wearing down the system, which you're doing, then you're going to have a really responsive and effective firefighting workforce.
Commissioner Mapps, go ahead, then Commissioner Ryan.
Sure, just briefly, I'm not sure what the next steps with this report are. I think it's a great report. One of the things that I do hope that happens is that we can loop in Mike Myers and the Community Safety Division so that they can take a look at this and use it in their planning around how we can build a comprehensive and integrated public safety system. That's it.
Okay. I just wanted to ask, because a lot of our community response teams are having staffing challenges, is your recruitment going well? Do you have a list of people that can't wait to be on Portland Fire and Rescue?
No,
Okay.
across the country, when it comes to community safety systems,
So it's not just
public
police,
safety,
you're
it's not
having
just
these issues as
police.
well?
We're seeing, huge staffing shortages and people really reflecting on, their lives, their families' lives. It's one of those things that when you go through crisis after crisis after crisis, you don't get a telework. You're not hybrid, right?
Exactly.
You have to make the sacrifice. Your families have to make the sacrifice. Your kids have to make the sacrifice. And you still, like I said, go through things where we lose people as well. But you still have to show up because that's your duty.
Yes. And so is there a waiting list, or is there,
No.
you have vacancies?
No, we are struggling like everybody else when it comes to hiring.
That's good to hear.
Howard, I'm sorry.
Well, no, it's more important for you to say something. You have to find the right microphone.
I'll find a microphone that works. As far as the staffing shortages that we're seeing, the way that we are managing that now is with mandatory overtime. So it takes a huge
That's why that
toll
lever. Okay,
on
got
our
it.
workforce. So this is a crew that's been at work for 24 hours. The next morning, we don't have people that are available to work. And so those individuals are told, essentially, you're mandated to work. And our folks are here, as Chief Boone eloquently stated, we're all here to serve the community, and we do what we need to do. But our personnel are absolutely taking the brunt of that shortage. They're missing family birthday parties, anniversaries, first days of school because we're mandating them to work. So.
I wanted to actually end with thanking the local 43 person every day of the year. So I appreciate that. Lily, this is the last one. When we have concerns out in East Portland, and we know that 165th-ish is the border between Gresham and Portland, what's that relationship like? I assume they help us out, we help them out, but I don't know.
I will just say, spending time out there myself when I first became a lieutenant, the fire service doesn't have any geographical boundaries. We aren't compartmentalized. And I know that's the jurisdictional authority boundaries, but our relationships when it comes to mutual aid partners, whether it's Gresham sharing a station, whether it's the Port of Portland, whether it's the other cities within Multnomah County, as well as, Washington County and Clackamas County, TVFNR, or across the nation, or across even the states. We work together and you cover. And so you see what we do on a local level, that if resources are taxed because of an incident, then we will move and shift other companies to cover that area, as well as our mutual aid partners will cover on the borders. So we go back and forth, and it's just a fluid system. And, for me, it's a great relationship with Gresham Fire and any of our mutual aid.
Thank you so much.
Recording in
I really
progress.
appreciate
You're
help
back.
in Portland. All right.
For putting that into the record, I think because we spent a lot of time focusing on East Portland, I wanted to make sure that we had this dialogue. Thank you.
Commissioner Mapps, did you say something? So, yeah, okay. So we're at the end of our time. Commissioner Hardesty obviously had another pressing engagement, but I know she would have thanked all of you, to the Citygate folks, Stu and Sam. Thank you for your tremendous work. Chief Boone, you and your entire team, all of you gathered here today, thank you for your tremendous service. I just want to put one sort of macro issue on the table. I have heard from all of our first responder bureaus, from the Fire Bureau today to BOEC and the 911 call center, to our Police Bureau, and even to our emergency management function in the city of Portland, that we're 20 years behind. And I've also heard that we're critically understaffed. And we all know that that not only leads to problems in terms of timeliness of outcomes and satisfactory service to the public, but it's also having an impact on our employees. And we heard that underscored today, just in terms of stress and health outcomes, burnout, and frankly, the desire of people to come to work for us. The problem is the solutions will all require ongoing funding. So we're not going to get bailed out by a fall bump or a spring bump, or even one-time only resources due to an unexpected windfall as a result of our economy. It would require us to really rethink our priorities in terms of what the city delivers. And I believe, based on this conversation, the other conversations we've had with first responder agencies, this council will have this question about retooling city government to focus on first responder activities. And that will be a controversial topic, make no mistake about it, but I think it's one we have to have. We cannot turn this over to the next generation of elected leadership and first responders in this city not having made a good faith effort to address it. And when we have data before us that helps clarify where the gaps are and what the need is, we need to heed it. So I found this to be a very, very useful work session. I want to thank Commissioner Hardesty in absentia for her and her team's terrific work on this. Chief Boone, thanks to you and the leadership of the police, or the Fire Bureau, and the Police Bureau, and BOEC, and Emergency Management, and all the others who are involved with first response in our community. And again, to our consultants, I'm not always happy or satisfied, maybe is the right word, with the work of consultants engaged by the City of Portland. This is a great opportunity, though, to say that you dug deep, you found relevant data, you gave us good comparators with what's going on nationally, you gave us great context for those of us who are not steeped into the day-to-day operations of the Fire Bureau, and it was a very, very good use of our time. So thank you all. Thanks, colleagues, for your good questions. We are adjourned.